Okay, hello everybody. I'm Marla with 9 Health, and we are here as part of the Buddy Check 9 Day, and we are here encouraging everyone to have the buddy system. It really works, and so we're going to keep each other on track. And this month is Colorectal Cancer Awareness Month, and we are here today with Dr. Shani Patel. And I'm going to let you tell them all of the things that you do, because you just told me, and it's a lot. So you're an assistant
Thank
professor.
you so much. Yes, thank you so much for having me. It's just such an honor. It's so important to be talking about this with everyone. Colon cancer is very common. You read the statistics and it's overwhelming. We hear that it's the second leading cause of cancer-related death.
Yes.
That really, it's the third most common cancer in the U.S. But the way that I think about it, the way that I talk to my patients about it, is that each and every one of us, 1 in 20 of us, will develop colon cancer without screening.
That's a lot, 1 in 20. And this is your whole job. You're a gastroenterologist. See, I can't even say it.
That's all right. You don't need to.
You say it.
A GI doctor. I'm a GI doctor.
She's a GI doctor. Okay, very good. And your whole job is really to help us prevent this cancer.
Absolutely. That's one of the most promising things about this cancer. Even though it's a common cause of cancer, a common cause of cancer-related death, it is completely preventable. We have so many effective screening techniques to not only detect it early, which is what we do with a lot of cancers, but really the most powerful thing is we have the ability to prevent it altogether.
That is great news. That is great news. So we're going to be here talking about that. You see behind us, we have navigators, GI navigators, who can help you understand what you need to do to go through the system if you do have a cancer diagnosed. And so they're here to answer your questions about colorectal cancer. And you can call in, or you can type in your question here, and Dr. Patel and I will try and answer your questions. So join the conversation. One of the things I was sharing with you before was that we did a series on the colonoscopy. Mm-hmm. So everybody's like, oh, I don't want to talk about that. It's poop, right? And so we're going to talk about that too. If you have questions about your colonoscopy and what that entails and how that goes, because you'll know firsthand, yes?
Absolutely. It sounds like a very intrusive, invasive procedure. God forbid things come into that hole, let alone just out of that hole. But it is incredibly well tolerated. It's a very, very powerful prevention technique. And all of it comes down to what we understand about why colon cancer happens. What we know is that the normal colon tissue over time can potentially develop into small precancerous colon polyps. Mm-hmm. And over time, those could potentially grow. They could potentially turn into cancer. And so when we do colonoscopies, not only are we looking for colon cancer early, but we're actually really hunting very, very carefully for these precancerous colon polyps. Mm-hmm. We can scrape those things out and essentially prevent you from ever even developing a cancer, prevent you from a problem you never knew you even had the potential to have. And so, yes, it's potentially intrusive to think about, but we have nothing parallel to it in medicine, this ability to completely erase the possibility of cancer.
That's pretty powerful. And, I will tell you, having gone through a colonoscopy, right, that it wasn't that bad. My experience was that the preparation for the procedure was worse than the procedure. The actual procedure, I went to sleep, and I never even knew anything happened. When I woke up, it was fine. There was, I couldn't even tell I had it. So it was really super easy. The preparation, however, is, you have to drink a lot of fluid, and, you have to be prepared to be close to your bathroom.
Yes.
Let me just say. But it wasn't bad, and it was totally worth it. I feel so good that I now know what I have a clean bill of health. Thank you very much.
So we have a comment. Heidi says, we can talk less about it and not bring attention to it. What would you say to somebody?
Yeah, that's a great question. Thanks, Heidi. We can talk less about it, and maybe why would we talk about this? Why are we here talking about this?
Well, we're healthy. We want to keep people healthy, and that's really the most important thing here, is that if you don't have any symptoms or problems, people say, I'm fine. I'm not having bleeding. I'm not having pain. There's no way I could have colon cancer. I would say that's exactly the person that needs to talk to their doctor about colon cancer screening, because we want to keep you that way. And so there is potentially the opportunity to just stick your head in the sand and wait till something happens. But if you take this moment when you are healthy, when you don't feel any symptoms, to go talk to your doctor about it, you could prevent cancer from progressing.
And what are the risks of putting your head in the sand and not getting screened and not doing anything until you have symptoms? What are the risks of that?
The vast majority of folks who wait until symptoms occur, and the symptoms that can be associated with colon cancer include bleeding from the rectum, sometimes abdominal pain, sometimes changes in your bowel patterns or in the caliber of your stool, and I know we might be getting into some topics that may not
but
be
we are. We're
appropriate
talking
around
about
dinner
poop
time.
today.
But, you know, if you wait for those symptoms, oftentimes the cancer is at an advanced stage. And so what we know about cancer detected early of the colon is that people have very, very good survival if they're able to get it treated early.
Right.
And they can have a cure. Surgical resection is a cure for colon cancer in early stages and can have a normal life thereafter. But when cancers are diagnosed at later stages, their risk of recurrence is higher. They have to go through more kind of intensive treatments such as chemotherapy or radiation. And so sticking your head in the sand is not advisable, because if you are proactive about your health, you can prevent yourself from having to deal with all of those health issues.
Yep. So that's why we're talking about it, even though it might be uncomfortable, it might be not the nicest thing to talk about, but why we're talking about it really is because colon cancer is preventable, and if you catch it early, you can actually have a normal life, whereas catch it later, you got a lot of problems. And the only other reason we're talking about colon cancer today is because by proclamation, this month is Colon Cancer Awareness Month. So not only do we think it's really important, and at 9 Health we think being proactive about your health and preventing health conditions is the most important thing. It sounds like you do too, right?
Yes.
But you know, here we go. We have a proclamation.
It's official.
It's official. So anyway, I don't know if we covered that quite enough, but you know, we do feel really strongly about it at 9 Health. We have probably 8 different screening tests you can do. We're having health fairs coming up here in April, and our whole mission is to really have people take action, be proactive, prevent the kinds of health conditions you can. And this is one of them. We actually have a fit kit at the health fairs that you can take. It's a take-home test.
That's exactly, that's a great point. You know, we've talked about colonoscopy briefly, but we have many other options for colon cancer screening, and some are stool-based tests that you do at home in the privacy of your home. They don't require this purgative bowel prep that can be a lot of
That's right.
commitment. Some are, you know, radiology tests like a CAT scan or an X-ray test. There's an option for everybody. So when patients ask me, Doc, what's the best colon cancer screening option? My answer without hesitation is the one that you commit to doing. It's so incredibly important. There's so many different options out there. There's always one that we can find for the patient, no matter what their hesitations, their modesty issues, or their social situation is. There's an option for everyone.
Great. Well said. You know, it's the one, the greatest test is the one you're going to actually do, right?
Exactly. Very practical approach to medicine, right?
That's right. That's right. So tell me this. You know, I've heard that younger people are actually having increased incidence of colon cancer. Is that true?
Yes, it's a very important issue to talk about. And so right now, for folks who do not have a family history of colon cancer, don't have any symptoms, we recommend starting colon cancer screening with these menu of options that we've kind of referred to at the age of 50.
Right.
And we've seen this as an incredibly successful approach in the United States, that really over the last few decades, as U.S. citizens have undergone more screening, we've seen a steady decline in the incidence and death associated with colon cancer.
So it's been declining over the years.
In those that are over the age of 50, but alarmingly, for those under the age of 50, we've seen a steady increase in not only the number of cases, the incidence, but also the death associated with colon cancer. We really don't have a great singular explanation as to why that is. There's a lot of theories out there.
What are some of the leading theories? Because I'm wondering. I think that's a very strange
phenomenon. Right?
It is. It is.
So there's some thoughts that, well, you know, colonoscopy is much more available. Maybe as we're seeing the decrease in older patients, we're seeing kind of a relative increase in younger patients. But if that were the case, just because colonoscopy is more accessible and patients might be getting it more frequently if they're symptomatic, we would expect to see younger colon cancers diagnosed at earlier stages.
Right.
But that's not the case. We're actually seeing that on average, if you compare those diagnosed with cancer under the age of 50 compared to those over the age of 50, the younger folks are actually being diagnosed at more advanced stages. So the other possibility is that
We're moving. We're moving.
I guess.
We're moving. We're moving.
Perfect.
Thank you. So we actually are at the TV station, and so they're doing TV, so that's why we're moving.
I guess we can't really disrupt daily business.
No,
right?
you gotta do TV.
But the other possibility is that perhaps there's something different about our environment, our exposures, the increasing risk of obesity. We know that to be a risk factor for colon cancer, diabetes.
So obesity is a risk factor for colon
the
cancer.
different environment and foods that we're exposed to that maybe we weren't 20, 30, 40 years ago. But I think all of those are still in the theoretical phases. We don't fully understand why younger folks have an increasing incidence of cancer. What I can tell you is that young patients are much more likely to present with colon cancer with symptoms, and their diagnosis tends to be significantly delayed. Okay, and so for a patient over the age of 50 complaining of rectal bleeding, it's about 28 days from the time they report that to their doctor to the time they get a diagnosis.
Okay.
For younger patients, from the time that that bleeding starts to the time of diagnosis is closer to 130 days.
Wow, why is that? You just don't suspect it, right?
There's a lot of reasons, and some of those are on us as a medical profession. Some of those are on a patient. If you're a 40-year-old gentleman taking care of 3 kids and you see intermittent bleeding, you don't want to worry the wife, and you say, oh, it's probably just hemorrhoids. And you delay and you delay and you don't necessarily mention it to your doctor until it's persistent, and then at that point it's possible that that cancer has progressed. Now, other possibilities certainly are on us as physicians, that same patient comes to our clinic and we say, you're young,
You're fine.
you're healthy, it's probably hemorrhoids, let me give you some ointment for that and come back in 2 months and we'll reassess.
So both things are kind of true.
From both sides. So really the critical importance in this whole concept of early onset colon cancer is to recognize that there are symptoms to colon cancer, and if a young patient has any symptoms like rectal bleeding or changes in their bowel habits, they should talk to their doctor immediately about it. And if their doctor is being dismissive, that they should see somebody else and really find an advocate for their health, because we do know that the rise of colon cancer in the young patient population is often found because of symptoms.
Yeah. Well, that's great advice. I mean, and that's coming from a doctor, a GI doctor. If you have symptoms and you're not getting treatment or you're not getting the answers, then you want to get a second opinion.
Absolutely.
Yeah, because it's important. Now, here's the thing: is if you do have symptoms, right? Sometimes it doesn't mean it's necessarily colon cancer.
Right. I don't mean to alarm every person out there who's ever seen a spot of blood on the toilet paper, after some Indian food, or it can happen to anybody. But to really just understand that if it's unexplained, if it's persistent, you should talk to your doctor about it.
And what's the harm in checking it out?
Exactly. So, your doctor may do a variety of tests, maybe some blood tests to make sure you're not anemic or iron deficient, an examination in the clinic. And if there's not a clear explanation for that bleeding, they could probably recommend a scope. It doesn't necessarily have to be a full colonoscopy. It could just be to look at that very last portion. These are very safe, very well-tolerated exams that really can just give you peace of mind and your doctor full assurance that there's not something serious going on in there, like a precancerous colon polyp that we could just take out and prevent a cancer, or a colon cancer.
Now, here we are back to the kind of scope and the screenings and everything, but I have a question.
Of course.
When you say scope and it goes up into the rectum, right? So, but it's pretty small, right? Tell us about what that entails. And you're asleep, right?
Absolutely. So if we skip the whole bowel preparation part, which we can talk about in detail a little later. So essentially, a patient, when we ask them to come to our office, we ask them to make sure they have an escort, somebody that can bring them to the appointment, take them home, because we'd like to offer you the sedation. And the sedation associated with colonoscopy is fantastic. It works great. It puts patients in a real nice twilight
I can
zone.
attest to that.
Right.
It was very, very nice.
It's very relaxing.
Straight off to a nice sleep.
Oftentimes with minimal to no recollection of the entire process.
Didn't remember a thing.
So essentially, we provide sedation, and the first part of the examination is a rectal examination. So we just do a digital exam, and then the diameter of our scope is about the diameter of my index finger. It's a flexible scope.
It's not that big.
No, it's a flexible scope. It has a camera and a light on the end.
Let's face it, our poops are bigger than that.
I, in no uncertain terms, say that to patients frequently. When they get a little bit nervous about something going up their rectum, I reassure them that the caliber of our scope is oftentimes much smaller than the caliber of their stool. But it's flexible. We have the ability to twist it, turn it, go up, go down, see around corners. And so we insert the scope to the very, very beginning of the colon, and we have the ability to examine the entire colon. not only can we see the whole colon, we can take care of things while we're there. So if we see a polyp, we just take it out. And the patient leaves that day with everything taken care of. No need to necessarily...
Now, if that didn't happen to me, but if it did happen, would someone feel some discomfort?
That's a good question. So lucky for us and lucky for our patients, there are no pain nerve fibers that innerve the colon, and so patients don't really feel pain. And we can take out large pieces of tissue or large polyps, and they don't feel that. What they feel is really essentially what we feel when we get a little gassy, a little bloated, because the colon is sort of like a deflated balloon. And we put gas or air into the balloon to be able to see. And so sometimes patients can feel the urge to pass gas. And in fact, we actually mandate that they pass all the gas that we gave them before they leave the office.
Okay, well, let's interrupt for a second because we have a question.
Well, Tim says, it's a comment, someone needs to fix the taste of the prep drink. That's the worst part.
Yes.
I agree, Tim. Thank you very much. Can you do that for us?
It is improving.
Just not to put you on the spot.
No, it's improving. That's a fantastic question. When people say, can you improve the prep, I think there's two parts to that. Improve it for you, but then also improve it for us as part of our exam. And so the whole point of that bowel prep, I would never admit it. Some people really, really think that we do this to torture patients. We don't.
You don't?
I promise you we don't.
Okay.
But the way I explain to my patients, it's sort of like your deck. After a big grueling winter, if there's a thick grime on your deck, no matter how much Lysol or cleaner you put on there, unless you get the power wash going, you're not going to be able to see the surface of that deck. And if there's a little bit of mold underneath, you're not going to be able to see that. You're not going to be able to see a polyp unless the colon has been power washed through. So that's really kind of the critical importance of the prep.
So the prep is the power wash.
Yes, the power wash. But, in terms of how we can make it more tolerable for patients, the taste of it, there's already been a few advances that have been made. It used to be a very large volume, salty solution. People would have to drink all of it at the same time the night before the procedure. Now we have solutions that are half the volume, so you don't have to drink as much of it. And you take half of it the night before the procedure and half of it the day of the procedure. And not only is that much easier to tolerate, I don't know about you, but if I drink, 750 ounces of water, I feel nauseous.
Yes.
So decreasing the volume makes it easier to tolerate, but it also results in a much better quality bowel prep for us because we get a final power wash right before the procedure.
Okay, well, that explains a lot.
Yes.
And it really, my experience is the same as Tim's. It's like there's so much to drink, and it wasn't very good tasting. It's bitter and salty all at the same time.
Let me tell you, there are going to be advances in the next few years.
Okay.
So just to kind of give you a preview of things that are currently under study. And so, of course, you probably have tried the flavorings and Crystal Light and things like that. Those things all help. Gatorade helps. But one of the most promising new prep techniques that's under study right now, not ready for FDA approval, is bars. Okay, so kind of similar to the taste of a fiber bar, but it has kind of a laxative component to it. You still have to drink a lot of water to get that power flush, but patients find it very, very well.
That does sound better.
That feeling of hunger is not there because you're putting something solid, you're chewing, there's flavor to it in your system, and what we're trying to make sure is it achieves the same quality bowel prep. But the results are very promising. So, Tim, if you have to have another colonoscopy, if you've had polyps, I promise you if you hang in with us, things will get better.
That's great news. That's great news. And you know what? I wasn't actually hungry. That wasn't the problem. It was really that, staying up for 3 hours or whatever, that you need to run to the restroom because it is a power wash, like she said, and when you can imagine what's happening. So that was the big
challenging for even the tightest of sphincters. Yes.
Challenging for me. So, but I read that 1 in 3 people over the age of 50 are not getting a colonoscopy. They're not, and that's, the recommended screening.
Right.
Why is that, do you think? Is it because of all of this, the prep and the people that don't want to do the screening and the little tube and the...
Yeah, I think there's a lot of reasons that go into that. I think part of it is that people may or may not even understand that colon cancer is an all-opportunity cancer. Some people say, well, there's none in my family, or gosh, I think it's a male disease, not a female disease. It affects men and women. It affects every ethnic background.
And now we're
race.
Talking about it affects younger people.
Even younger patients. And so I think there's some misconceptions of sort of, well, it's never happened to my family, so it can't happen to me, or only affects men. It affects men and women. It affects everybody. So that's part of it.
Okay.
I think the other part is that there's a lot of fear and misconception around the screening tools. And tests like colonoscopy, you know, we talk about it, we joke about it, but that can be very intimidating for some patients. And if they feel that that's the only screening tool, they kind of say,
I'm not doing
just
it.
not for me,
Yeah.
you know,
Okay.
or I'll handle things as they come. And I think the other part of it is that we don't do as good of a job as a healthcare profession explaining just how powerful of a prevention tool this is. Okay, so in contrast to, say, for instance, other cancer screening tools.
Like a mammography, for example.
Yeah, when we get a mammogram, we're trying to detect cancer early, right? So if you find a lump or if you find a spot, then your doctor says we got to biopsy that, and you may have a cancer. Now, that mammogram may have detected it early before it spread to any lymph
Right.
nodes or is all that serious, but it's still a cancer.
Right.
With colonoscopy and other colon cancer screening modalities, we have the ability to just prevent that entire process
Right.
altogether.
Right.
A colonoscopy, a polyp removal, is a day in, day out procedure. I was joking before this interview that that's 16 times a day for me, every 30 minutes. That's my job.
No wonder you're so good at it, right? I mean, you really know how to communicate about this, and that's really important because I do think that a lot of us are a little bit squeamish, maybe. It's like our body part, and we don't want that.
Yeah.
Things go. What do people say? Things go out, not up.
Right,
you
right.
know?
One-way
It's like-
road. Yep, I've
it's a
heard it all.
one-way road.
I've
You've heard it all, right?
Yeah.
And so the more we talk about it, I think the more we can kind of quell those myths and make people feel a little bit more comfortable.
And I think, you know, with my colleagues here, these nurse navigators, we have the ability to bridge that gap from sort of patients' circumstances, their fears, their concerns, to sort of the doc in the room that's going to do this procedure, okay? So the number of times I've had a patient tell me, I've been putting this off. My doctor ordered it 7 years ago, and then a year after that, and the year after that, and then finally I'm here because I heard that if I just asked, I could have an all-female team.
You know, I'm not allowed to take
And really, that's something from the provider side. I feel terrible to not even think about making sure
So
we
you
make
can
that
ask
available.
to have an all-female team if that would make you feel more comfortable.
Female gastroenterologists, just like myself, and you know, this is what we do. And we
What about
wanna
an
make it-
all-male team? Could you get an all-male team?
You could
if
probably
wanted?
get an all-male team, and you know, really, whatever your preference is, as long as we understand that we can provide a procedure to you in a safe and effective way, we'd like to accommodate time of day. You know, whether it's a
That's
morning
good to know. I
procedure,
would have
evening
never
procedure.
thought to ask that question. And it didn't stop me right from getting my colonoscopy, but I would have.
There's, you know, some other cultural aspects or modesty issues,
Yes.
and we want to reach out to every single patient, not just the ones that make their way to our doors.
Well, this is really great. Well said. And we've covered a lot. You mentioned family history.
Yes.
How much does that influence your risk?
Absolutely. So we talked about 50 years old being kind of the time to start screening. The big caveat to that is as long as you don't have a family member that has been diagnosed with colon cancer. And so we know that if you have a first-degree family member, brother, sister, mom, dad, who's had colon cancer at a younger age, and we define young as under 60, that your
okay.
risk of colon cancer is significantly elevated. Okay?
Okay.
And so, for instance, my patient who's 42 years old, her brother just got diagnosed with colon cancer at the age of 45. And if she doesn't tell her doctor about that, her doctor's not going to offer a colonoscopy or colon cancer screening until she turns 50.
Right.
Okay, but because her brother was diagnosed with colon cancer at a younger age, she should be getting a colonoscopy 10 years before he got diagnosed.
Okay.
Okay, and every 5 years.
So at the age her brother got the colon cancer, she should try and get screened 10
years earlier.
Earlier.
10 years earlier. Yeah, and
So
if
if
it's
he's 45, she should get screened at 35.
35. And every
Wow, that's
5
early.
years instead of every 10 years. And part of that is
I don't think I knew
because
that.
of this process of what we know about how colon cancer develops. We know that the process from normal tissue to tiny little polyp to big polyp to cancer, that process can take 8 to 15 years.
Okay, so it's slow.
And so if it's something familial, if it's something drifting down through the family, if mom got diagnosed with colon cancer at age 58, we would hope that if we can catch her son and her daughter
yeah,
at
10
48,
years before.
that we find it when it's a teeny tiny polyp. We take it out and we prevent that family from ever having to deal with that cancer again.
Very good.
And
That
so-
makes a lot of sense when you say it that way.
You know, when patients ask me, well, when should I talk to my doctor about colon cancer? Now. Even if you're 20, even if you're 30, and your doctor just needs to get a full family history, find out what's going on with mom, with dad, grandpa on both sides, siblings, kids. And if they say, okay, based on all this information, 50 years old, put it on your calendar, you can go into your Outlook calendar and put it on there for when you turn 50. But if they learn information that qualifies you for getting colon cancer screening earlier, you have to have that conversation ahead of time.
Right. And you know, I love that you say colon cancer really is preventable.
Yeah.
So are there some lifestyle
Yes.
things you can do to help reduce your risk?
Absolutely. So my cardiology colleagues will love me for this.
Okay, good.
What's good for your heart is going to be good for your colon, okay? So we know that the things that can increase risk of colon cancer are diets that are high in red meats or processed meats, abdominal obesity, diabetes, prediabetes conditions, and smoking, okay?
Yeah.
And those are all the things that are not so great for your heart and your blood pressure.
For your health in general, I
Exactly.
think, right?
The things that we know are protective of colon polyps and colon cancer are diets that are high in fresh fruits and vegetables, so high fiber diets, daily physical activity and exercise, and low BMI. So if you can do everything you can to keep your heart healthy, your blood pressure good, that is going to benefit your colon.
Yeah, it helps everything. Okay, good. So, it's not only good for your blood pressure, but it's good for everything else
Yeah.
too. Okay, so do we have another question?
Yeah, Kelly says, any correlation between hemorrhoids and a possibility of developing colon cancer in the future?
That's a great question. So hemorrhoids, just to overview, are very common. Those are essentially small little veins that everybody has right at the very, very bottom of your rectum. And over time, with pressure, those veins can get enlarged, okay? And sometimes, if those veins are enlarged and there's some trauma that goes through those veins, like stool, they can bleed, okay? And so, as all of my female friends out there know, particularly if you've had a few pregnancies and you've got a lot of pressure down there, those can develop.
Right.
There is no correlation between the presence of hemorrhoids and a colon cancer or a colon polyp.
Okay.
And having hemorrhoids doesn't increase or decrease your risk.
Okay.
However, what I would say is that if you're having bleeding and your doctor has not explained why you're having that bleeding, we want to make sure that's not just run-of-the-mill hemorrhoids. We want to make sure it's not because of a precancerous colon polyp that's sitting down there pretty low and causing bleeding, or a colon cancer that's causing
Right.
bleeding.
Right.
So if you're having symptoms, get those checked out. If you have hemorrhoids, be reassured that your risk of colon cancer doesn't increase. It's not protective, it doesn't decrease.
Right, and
It's
it might
about
be
the
good to
same.
know that you have them, right, so that you know what that
bleeding is
what
from.
that bleeding is
Exactly.
from instead of colon, something that was in your colon. Yeah,
Absolutely.
good. Well, good. That's a great question. Thank you for asking that. I do want to let everyone know that there's since today and this month is Colon Cancer Awareness Month. The Undie Run Walk
Yes.
is coming up, and so it's really sponsored by the Colorectal Cancer Alliance, and we have somebody in our office. It's June 23rd here in Denver. I have the little flyer they gave me, and one of our work associates, Kendra, is a colon cancer survivor, and she's very young. She's I think 37 now, and she was diagnosed probably 5 years ago at least. And so I'm sorry, she's told her story, so I'm not disclosing her information without her permission. But
The Undie Run is fun, okay?
you go to that?
Yes, oh yes, we sign up for all these races, right? Everybody in Colorado trying to be healthy,
Yes.
and you get the free t-shirt, and you've got an entire closet full of free t-shirts. This is the run where you get underwear. Seriously, you get a pair of boxers when you run the Undie Run.
That's
so
great.
Diversify your, race.
No more
gear.
T-shirts. You
Yeah.
get the boxers.
That's right.
great. Yeah,
That's
so you can
right.
see them
Thanks
right
for
there.
that.
Yeah, very good. Very good. Well, very good. Thank you so much for joining us. This has been so informative, and I really appreciate it. We have health fairs coming up here in April, so if you're interested in checking out your risk for colon cancer and other things, go to 9healthfair.org and check that out. There are patient navigators that can help you if you have a cancer or if you have a question, and there's other resources that are available to you on the Buddy Check 9 page at 9news.com, so check that out as well. So thank you guys. Thanks so much for joining us. And
Bye.
We'll talk to you later.